Hmm. See, I am South Indian fellow advising North Indian people how to maintain the temperature of room. It is funny that people in North India during such cold wave, when the outside temperature is dropping to 2 degree 1 degree, are not at all able to maintain room temperature above 23 degree. Internal room temperature should be somehow maintained at least 22 or 23 for children, especially late in the night. Otherwise, there is a connection between nose and ear internally. Immediately that will get blocked for small children, and they will have extreme difficulty in taking breathing through nose, as well as they will have immediately ear pain. They will have difficulty in sleeping. Now, why this is happening? These people in cold areas, they put a lot of sweater, a lot of cap and everything, and they feel that the air gets warm by putting clothes. It is the air which goes inside the nose which need to be specifically maintained. The body temperature in winter season, if the temperature is maintained around 23 or 22, you will have to just put an inner and a jumpsuit. That's it. But if you are putting more sweater and not maintaining the room temperature, you are going to have a child ending up with ear infection or ear pain. Point number 2, the air need to be humidified also. Cold air is less dangerous. Dry cold air is extremely dangerous. So in addition to maintaining the temperature, you will have to maintain the humidity in cold climate. How can you do that? If you are using a blower, put very damp cloth in front of the blower so that the dry air becomes wet air. Otherwise you use a steamer. Okay? So by that you will have to maintain the humidity. For that there will be some expense. Electricity is not free in India. If you are trying to conserve the electricity, the money conserved on electricity will be spent on doctor. There is no point in living like this. That you need to be extremely careful. By putting more clothes, we find excessive sweating in children. Because the nose, which regulates the internal temperature, that is exposed. Body will try to increase the temperature, and there will be more sweating. There is no fun in having excess of clothes but not maintaining the temperature of your room. You need to have there are applications in the mobile phone which determines the room temperature. There are clocks available, 100 rupee clocks, digital clocks with temperature. For children, small children, you will have to maintain the temperature. At least till 2-3 years you will have to work hard. After that they have become bigger children, no much of an issue. Ear infections are extremely common in small children. Pneumonia and ear infection are only prevented by humidifying the air and maintaining the temperature. Now, third point, common cold is not caused by cold. Cold हो गया. Cold is not due to cold. Cold is due to virus. Virus entering the body through a dry nose, dry lungs, dry throat, and causing pneumonia or ear infection or other infection. If proper mucosa is humidified and it is wet, the mucus can trap this bacteria and virus and most possibly destroy them also. Cold cannot be prevented by putting sweater. Cold need to be prevented by viral destruction methods, by using what you call proper cleaning methods, proper hygiene, hand washing and other things, and preventing the smokers and alcoholics from entering the room, and other methods of humidification. You can't prevent a cold by putting up sweaters because air goes through the nose. If you can't cover the nose of children, they will suffocate. So make sure you remember these points. I will summarize. Cold is not cold, it is due to virus. Humidify the air and maintain the temperature around 23 or 22 or even more. Take care. Have a good winter.